1. Which principle of adult learning is most applicable when developing addiction counseling training for experienced practitioners? A. Adults prefer extrinsic rewards over intrinsic motivation. B. Adults learn best when the material is abstract and theoretical. C. Adults value immediate applicability of content to real-world practice. D. Adults rely on rote memorization to ensure long-term knowledge retention. 2. In curriculum development for MCAP trainees, which step should occur first? A. Selecting instructional delivery methods. B. Conducting a needs assessment. C. Designing evaluation rubrics. D. Scheduling instructional sessions. 3. When evaluating the effectiveness of a training module on ethical compliance, the most rigorous method would be A. Participants' self-report surveys. B. Post-training multiple-choice test. C. Observation of practice with standardized clients. D. End-of-course satisfaction ratings. 4. Which of the following best demonstrates formative evaluation in MCAP curriculum? A. A summative exam at the end of training. B. Mid-course peer feedback sessions. C. Certification test results analysis. D. Annual review of licensure pass rates. 5. An adult learner resists using motivational interviewing techniques in practice. Which mentoring strategy is most effective? A. Direct correction with no further discussion. B. Modeling the technique in role play and encouraging practice. C. Requiring a learner to memorize MI principles. D. Assigning a reading without feedback. 6. Which communication strategy ensures compliance with federal confidentiality regulations during group supervision? A. Using real client names in open discussions. B. Referring to clients by coded identifiers. C. Allowing unrestricted information sharing for learning. D. Discussing case details via personal email accounts. 7. When developing a curriculum on opioid use disorder treatment, cultural competence should be addressed by A. Limiting discussion to DSM-5 criteria. B. Using only pharmacological treatment examples. C. Including diverse case scenarios reflective of multiple populations. D. Focusing solely on relapse prevention. 8. In adult learning, the role of self-direction is most evident when the learner A. Relies exclusively on instructor-driven lectures. B. Develops personal learning goals tied to professional practice. C. Depends on memorized definitions for exams. D. Requests only step-by-step instructions. 9. The most reliable way to measure knowledge transfer after training in relapse prevention techniques is A. Asking participants to describe content in their own words. B. Evaluating observed counseling sessions for proper application. C. Conducting end-of-class quizzes. D. Gathering general course satisfaction ratings. 10. Which principle of andragogy most directly supports experiential learning in addiction counseling? A. Adults learn best through passive lectures. B. Adults require content unrelated to their experiences. C. Adults bring prior knowledge and want to apply it to new learning. D. Adults prefer to avoid reflection on past experiences. 11. When preparing trainees to handle ethical dilemmas, the best instructional approach is A. Providing a list of rules without application. B. Incorporating problem-based learning with real case studies. C. Limiting instruction to legal statutes. D. Using rote memorization of codes of ethics. 12. Which evaluation tool best measures long-term outcomes of MCAP training programs? A. End-of-course knowledge test. B. Follow-up surveys on workplace performance. C. Attendance records. D. In-class participation scores. 13. Which mentoring action best models reflective practice? A. Sharing personal experiences without inviting dialogue. B. Encouraging supervisees to examine their decisions in practice. C. Correcting supervisees without discussion. D. Providing only technical advice. 14. The principle of immediate relevance in adult learning implies that curriculum should A. Focus on theory first, application later. B. Include direct links between concepts and clinical practice. C. Be limited to regulatory policy. D. Exclude case examples. 15. A regulatory compliance module on HIPAA should prioritize A. Case-based exercises on confidentiality breaches. B. Memorization of HIPAA text. C. A lecture-only review of legislation. D. Role play unrelated to compliance. 16. What is the primary advantage of using performance-based assessments in MCAP training? A. They are easier to grade than written tests. B. They focus on learner satisfaction. C. They directly measure skill application in practice scenarios. D. They reduce time spent on instruction. 17. In mentoring new professionals, effective feedback should be A. General and delayed until program completion. B. Specific, timely, and tied to observable behaviors. C. Focused only on mistakes without recognition of strengths. D. Withheld until requested by the mentee. 18. Which curriculum design element best supports regulatory compliance training? A. Static lecture slides. B. Scenario-based learning aligned with regulations. C. Abstract discussion without context. D. Memorization-focused handouts. 19. When evaluating a training on cultural sensitivity, the best metric is A. Pre- and post-test scores on cultural knowledge. B. Participant attendance logs. C. General program satisfaction surveys. D. Number of PowerPoint slides used. 20. The role of the MCAP as a mentor most directly includes A. Providing therapy to mentees. B. Facilitating professional growth through guided reflection and feedback. C. Supervising only administrative tasks. D. Delivering certification exams. 21. Which communication barrier most undermines mentoring effectiveness? A. Using open-ended questions. B. Overuse of technical jargon. C. Providing reflective listening. D. Encouraging dialogue. 22. In adult education for addiction professionals, which instructional method fosters the deepest learning? A. Reading assignments only. B. Lecture-driven presentations. C. Case-based collaborative problem solving. D. Memorization drills. 23. When aligning curriculum with accreditation standards, the priority is to A. Ensure content reflects required competencies. B. Focus only on learner interests. C. Minimize references to official regulations. D. Emphasize time efficiency over quality. 24. Which principle distinguishes summative evaluation from formative evaluation? A. Summative is ongoing. Formative occurs at the end. B. Summative occurs at the end. Formative occurs during instruction. C. Summative is optional. Formative is mandatory. D. Summative focuses on feedback. Formative measures outcomes. 25. Which strategy is most effective when mentoring an adult learner struggling with professional boundaries? A. Ignoring the issue until the learner gains more experience. B. Reviewing ethical guidelines and role-playing boundary-setting scenarios. C. Offering no guidance to encourage independence. D. Providing only written materials without discussion. 26. The principle of readiness to learn in adult education suggests that MCAP candidates are most motivated when A. Learning is tied to current professional responsibilities. B. Content is abstract and unrelated to practice. C. They are told to learn without explanation. D. Learning tasks are irrelevant to their goals. 27. In evaluating training on clinical documentation, which method ensures validity? A. Asking participants to memorize definitions. B. Reviewing participants' actual documentation samples. C. Recording attendance only. D. Using generic multiple-choice quizzes. 28. Which communication strategy promotes a supportive mentoring relationship? A. Interrupting frequently to provide corrections. B. Using reflective listening to validate experiences. C. Dismissing concerns to maintain authority. D. Delivering only one-way instructions. 29. Which curriculum development step ensures alignment with licensing requirements? A. Randomly selecting topics of interest. B. Cross-referencing learning objectives with MCAP standards. C. Prioritizing convenience over content accuracy. D. Skipping regulatory reviews. 30. In adult learning theory, intrinsic motivation is supported when A. Learners are offered external rewards only. B. Content connects to personal and professional growth. C. Tasks are unrelated to learner experience. D. Learners are excluded from decision-making.